Okay, Sarah, so if you could just kind of give me an idea of how things have been for you since we last met.
Yeah, this week has been a little bit difficult. I found it really hard to sleep the last few nights. So I think it's because a few nights ago I had like a really bad nightmare where I like envisioned the lorry like coming towards me, and then now I avoid sleep because I don't want to be back in that state of panic.
Right, okay. So that was last week when you had the nightmare?
Yeah.
And how was it when you woke up?
Like I was really hot and I was like all bothered and I just didn't want to go back to sleep. I think also because I've been having quite a lot of daydreams where I'm back at the event, it feels like I'm back there and I'm trapped and it's happening again. So yeah, it's been quite tough this week.
Yeah, so it sounds like it's been a difficult weekend, that there's been quite a few nightmares, some daydreams, kind of flashbacks in the daytime. Yeah. And you've mentioned there that you've felt like you were back there. Yeah. Yeah, okay. So it sounds like you might be experiencing what we call dissociation. Okay. Is that something that you've heard of before?
I think I've heard of it, but I don't know much about it.
Well, dissociation is it's when people lose connection with the present, and it can feel like they're maybe back at another time, or they can feel quite disorientated or confused about where they are. Okay. Does that sound familiar? Yeah. It sounds a little bit like what you were saying. Yeah, definitely. Yeah. What sort of times does that happen for you then?
It tends to happen at night, when I'm asleep. I might have a nightmare and that might, bring me back to kind of being trapped in the car and being like in a state of panic. But sometimes it happens when I'm at work and I'm not doing that much and my mind starts to wander a bit.
Okay. Yeah. So it's happening reasonably frequently at the moment then, So it sounds like it's something that's quite important for us to think about a little bit more. Okay. So maybe if I explain to you first a little bit more about what dissociation is.
Yeah, that'd be great.
Okay. I think it might be easier if I jump up and kind of do a bit of drawing on the flipboard, if that's okay. Yeah. Cool. Okay. So the important thing to remember about dissociation is it's actually a really normal human experience that lots of people report experiencing to some level. Okay. So we talk about dissociation as being along a continuum. Okay, so at this end, which is dissociation that most people report, people might talk about things like, so I was just going on autopilot and I was wondering if there's anything that you can think of maybe before your car crash that reminds you of that.
Of like time going by really
fast. And maybe feeling like you're on autopilot.
I suppose like if you're watching a film and like you don't realise the time passing, or if you're like having a really good day and it's like 5 o'clock and Yeah,
that's a really good point. So often people kind of don't notice that time's passed. Yeah. So it's kind of films, books can kind of reading, it's the same thing, Okay. Daydreaming is one as well, and the other one that comes up quite often is when people are driving maybe a journey that they've done time and time again and sort of just arrive there and don't necessarily remember all the details of their journey.
Right.
Yeah. At this end, dissociation is really quite problematic and really interferes with people's day-to-day lives, and people can find that they're not functioning very well at all. So it's a lot rarer at this end, not as many people experience it. Okay. Well, what happens is that when people go through traumatic experiences, so similar to the ones that we've talked about with your car crash, it pushes you up this continuum. And most people who are experiencing symptoms of PTSD tend to be around this part of this continuum. And what happens is that the types of dissociation that they experience can be quite different, and the intensity and the frequency can increase as well. So you were talking about your nightmares and your flashbacks and some of those images that you get, those would be the types of dissociation that you'd be experiencing. So I'll just pop those on here. So what do you make of that so far?
Yeah, I didn't realise that it existed, you know, in the autopilot example that you gave, so before trauma, so that's interesting to see it, you know, visually there. Yeah.
So it's really normal, but it's just that you've crept up this continuum a bit, really. Okay. So it sounds like your nightmares and your flashbacks and your memories are causing you some difficulties at the moment. So I suppose it makes sense for us to maybe think about how we can help you come down this continuum a little bit. Yeah. So one of the main ways that one of the main things that we do with regards to dissociation is we use something called grounding. Okay. So grounding techniques kind of do what they say on the tin, really. It's about grounding you in the present moment. I suppose it's like keeping 2 feet on the ground, because when people dissociate, they lose that connection with the here and now and can kind of become quite disorientated. So grounding is kind of the opposite of that and helping you to stay present in the moment. Okay. So there's lots of different ways of using grounding, but some of the people that I've worked with in the past have found it quite useful to think about it in terms of the 5 senses. Just means that we can give you lots of different options to try then. So I'm just going to kind of draw a quick table up on here. All right. Okay, so we've got touch, taste, smell, sight and hearing. So maybe if we take the example of your nightmares and we can think through some of the things that you could do to help ground yourself in the present moment when you come to from a nightmare.
Okay.
Yeah. So where do you want to start on this?
Maybe touch.
Yeah, touch is fine. Okay, so thinking about when you wake up from a nightmare then, where are you usually?
In my bed. In my bedroom.
Okay.
Yeah.
So is there anything that's around you in your bedroom that might help remind you where you are?
Yeah, I have a throw on my bed, which is really soft. So maybe that could be a good thing to touch to remind me that, you know, I'm in a safe place in my bedroom.
That's a really good example, and it also sounds like that's quite comforting to you as well. It's really important. Yeah. Okay, so that's a great example. What do you think for taste? A trickier one.
I could like keep something next to my bed that like a mint or something.
Yeah.
Yeah.
Great. And what about smell?
I suppose my room smells a bit like perfume, or like if I've lit a candle, it's kind of got a homely smell about it.
That sounds quite soothing as well, I guess, similar to the throw example you gave. Okay, let's pop those on. Maybe one thing just to mention about the perfume is that when we're thinking about grounding techniques, it can be really, really helpful to think about things that have happened since the crash or that you don't associate with the crash, because the last thing we want to do is to be kind of, kind of feeding into those memories. We want it to be something that's quite separate. So it just made me think when you said perfume that it might be a better idea to smell a perfume which you weren't wearing at the time of the crash, for example, or maybe one that you've bought since.
Okay, cool.
That makes sense, yeah. What about sight?
Maybe I have like some photos in my room which might remind me of like, you know, loved ones or, you know, fun things that I've done. Yeah.
What about this one, hearing?
It's usually quite quiet in my bedroom, except for maybe like my partner's snoring or like breathing.
Yeah.
I don't know.
Yeah, no, that's a good example. Yeah, so your partner snoring, and remind me, were you on your own in the crash? Yeah. So that's a really good one, because maybe if you were able to listen to your partner snoring, it might also remind you not only where you are, but also that you're not on your own as well. So that could be quite a useful one. Okay, so we've got some really good examples here. So when do you think you could use this, or when do you think this might be useful to use this approach?
Well, at night it would be really useful, because a lot of those things are to do with my bedroom, but also I suppose if I was at work and I was having a daydream, then I could just have some, or if I was in the car with my partner and I was getting in a panic, I could just have some mints nearby, and maybe that would give me like a strong taste of something that I didn't have when I was in the car and the lorry was coming towards me.
Yeah. So again, it's about reminding yourself where you are and really emphasising what's different about that situation. Yeah, great. Okay. So yeah, we've got lots of different options really, because for that reason, if you're in the car going somewhere, maybe with a family member or something, it's likely that your partner's going to be with you snoring. You might well be, but yes, it's good to have some different options. So the idea isn't that you kind of try all of these at once. It's more about you going away and trying some things out and working out what works for you, and then you can carry on using the ones that fit for you.
Okay.
So have you got any questions about any of that, or any kind of feedback on how that was, looking at that?
Yeah, I think it could be useful. I'm willing to, obviously try whatever I can. With the photos, could I use photos on my phone? Like, if obviously I'm not in my room.
Yeah, that's a great idea. Most people have got these smartphones now, haven't they? So yeah, that's a really good option as well. Yeah. Okay. So maybe if you go away and have a go at some of those things, and maybe we can have another chat about it next time.
Okay, great. Thank you.
All right, thanks, Sarah.